Studios. It's a bit humid out there today, Rhino. Representative Becky Currie joining us now. You can cut it with a knife out there.
It is.
Yeah.
It's January, too. What's the deal?
I don't know. I don't like that in January. Typically, it foretells of bad weather, severe weather. Hopefully, that is not the case. I hadn't looked at the forecast. Appreciate you coming in, Representative Currie. We should start out. We have a mutual friend that I've actually talked about on the show and have not revealed the name of this individual, but I think he'd be perfectly fine with it. He has been in the hospital now dealing with a heart issue for about a month, I think.
Right. Our friend is Bill Billingsley, and if he's mad at anybody, he can be mad at me. I don't know if you know this. Bill was my boss for a long time.
I did know that now that you say it.
Yeah.
I remember him talking about that. Yeah.
And we became good friends, and we both loved politics and just always talked politics. And so I'm glad to hear he's doing better.
Back home, as of yesterday.
That's right.
Looks like he's got a great prognosis.
That's right. Yeah. Give a shout out to him and his wife, Stephanie. I'm thinking about him and praying about him a lot.
Yeah, absolutely. Great people, and so glad that the outcome was positive. You know, he was ready to get out of that hospital.
You know he was.
This happened the week before Christmas.
I know.
And so he spent the entire holiday period in the dang hospital. And but we're glad that he is out and at home and resting comfortably, and looks like he's on his way to a full recovery, and we're so happy.
Which is remarkable.
It truly is,
right.
No doubt about it. So appreciate you pointing that out here. So there you go, folks. That's our good friend that I've talked about. In fact, the day he had surgery last week, I was really concerned. It's no simple procedure that he had last week. Yeah, but he fared well.
He did well.
Yeah, so
good
we're
team
happy.
there.
Yeah. All right. So you guys have been down there at the Capitol for a little over 2 weeks and all in session. What's going on with respect to just high-profile issues that are getting a lot of buzz? What are you hearing down there at this point?
Well, of course, we're looking at income tax or some kind of tax. I think, the best one that people have seen so far is your car tag. You know, the one you can go in and see immediately is the one that you like the most. So we cut a great deal on your car tags, and I'm proud of that. You know, I want to say that I'm proud to be a part of this legislature that has gotten Mississippi in the best financial shape of our history. And we can't say that in D.C. You know, it's a completely different ballgame. So I'm real happy about that. So we're looking at more ways to give people back their money. And, hopefully we can do it. I like a lot of people would love to see the grocery tax cut, especially for the elderly and poor people. It's very hard right now with inflation. And so I'd like to look at things that you can see immediately. Yeah.
So certainly those are two, I think, options that do help in that regard. A lot of folks are still anxious to potentially see full elimination. I know the Speaker's made that his top priority. There's no secret there.
No, there's none. And he is definitely looking at it. And I know that the Senate has different versions. And in couple of months we may know which version we're going with.
Yeah. The difference of viewpoints there. I think the Senate's more inclined to just issue a one-time rebate. Certainly the lieutenant governor favors that approach, a little more tentative and hesitant to just start working on total elimination, whereas the Speaker believes we can do it. And then we had Representative Trey Lamar from Ways and Means on last week talking about that as well. That seems to be a high priority to him and his efforts and his chairmanship. So we'll see where that goes. That should be interesting. The one issue that I have asked everybody about, that I'll certainly pose this question to you as well to get your take on it, is the citizen ballot initiative that, of course, has been nullified essentially by the Supreme Court of Mississippi based on the Initiative 65 lawsuit brought by Mayor Mary of Madison. And so the Supreme Court found in favor of the city and said, this really doesn't match up with our congressional districts, and so the law as it stands presently in our Constitution is invalid, if you will. So we had a House bill, we had a Senate bill, we couldn't get any congruence there, therefore we didn't get a bill to the governor. What do you think is going to happen in this session?
Well, we didn't like the Senate bill. It added more signatures.
Yeah.
And, you know, we were taking it out of the Constitution was the most important thing. Let's just face it. We don't want anything to mess with our Constitution, but it's very difficult to get those signatures. I've participated in those before, and it's very hard to get that many signatures in that many congressional districts. So I thought that we shouldn't make it harder. To let the people have a voice. And so I'm there. That's where I am. Don't make it harder, but we've got to be able to give this back to the people. We cannot walk away this year without doing that. I
will report that it's probably the number one issue that I hear about out in public. That's the one thing that was kind of left unfinished by the legislature last year. They still feel like that, hey, the people are out here just kind of on an island. They're a boat adrift at sea without any mechanism to bring something up for a vote.
That's right.
Across the state.
And we cannot leave them without a voice.
Okay. Well, hopefully we'll get something this year. So let's talk about your committees. Why don't we start with the House Tourism Committee?
Okay.
What do we have going on there?
Well, you know, we did a really big bill last year for ARPA funds, and unfortunately, the cities that participated in that haven't received their money yet. So it's kind of hard going back in for more, but, you know, the governor vetoed a lot of bills, so we have more money in the ARPA fund. So I want to come back and do another tourism bill. For every dollar, you get back 13 in tourism. So, you know, it's the only committee that makes money. We usually dole money out.
It's a revenue-producing
That's right.
entity.
Which is wonderful. And we have so much going on in the state of Mississippi. Every day there's somebody new coming up with something. I want to tell you about a fun bill. We don't have too much fun going on in government, but it's been brought to my attention from some geologists at the University of Southern Mississippi that we are rich in opals. We don't have a state gem, and we don't, unfortunately, have diamonds and rubies, but we have opals. And Copiah County, which is part of my district, is one of the counties that is very rich in this. So we're going to make the opal, since it's our only gemstone, our state gemstone, and just try to do some things like, wouldn't it be fun to see kids? Camp Kamasa is in part of the district where it's
Copiah County,
Copiah County, and kids are going to go there, and they could, these people from the University of Southern Mississippi, they are so excited. They want to come and teach you how to look for opals.
That's cool.
Yeah, isn't that cool?
Yeah, that's neat.
So,
something fun.
That's right. We got to have something
Need
fun.
that. All right, so something that ain't fun right now is health care in the state of Mississippi, which seems to be, if not already there, headed for crisis level.
It's past crisis level. It's about to be extremely bad. We have a lot of hospitals that are on the line. Our hospital where I live lost money last year, and you're going to see a lot of problems. And I've been in healthcare all my life. I'm a registered nurse, and I've been supportive of us looking at different things to help our healthcare. And we all know our insurance companies are doing well. They making billions of dollars a year, but yet they don't pay our hospitals and providers like they should. That's the reason you saw UMC, and Blue Cross in such a battle. And if other hospitals had joined the battle, we might have done better. But it's just something that we have got to sit down and look at. You look at hospitals and say, oh, they send me a big bill. They're making tons of money, but they're not.
Yeah, no, they're not. And we'll get into that on the other side of the break. We've got Representative Becky Currie in the Element Well Studios coming right back on midday. Well Studios. Thomas in Greenwood wants to know, are there any hospitals in financial trouble in states that expanded Medicaid? I can answer that question real quick for you, Thomas. Every single hospital in the country is in trouble. The entire industry is about to implode. And I could sit here and send you dozens of articles from industry analysts, I don't mean from government, that substantiate this. It is a nationwide problem. The issue is that there's just too much uncompensated care, and that doesn't come solely in the form of patients who are receiving medical care that don't have any insurance. I'm told, Representative Currie, by my close friends that are in the hospital management business. I'm not talking about doctors who are just focused on delivering medical care. They don't get into all the details of the financial aspect and don't want them to, honestly. But the people who are responsible for making the numbers work, one of the things I've learned in the last few weeks is the high number of defaults that we have on the patient responsibility of care. I'm a patient, I've got insurance, I go to the hospital, and I get some ridiculously expensive medical care, and insurance pays for it, but I'm left with perhaps part of the cost because I'm still in the deductible period or I have co-pays or what have you. They just don't pay it. And so the hospitals are telling me they've got a huge amount of just delinquent accounts that they end up sending to collections who don't pay. And even if they do, they still only get 2/3 of that, generally speaking, which is upside down because the collection agent gets the third for collecting the outstanding balance. So that's a problem as well. So to Thomas, to your question, this isn't just about Medicaid expansion. It's about just the financial difficulties in the healthcare industry overall in general. And I think this is a debate that's going to get a lot of attention during this session. Your thoughts?
Well, I do too. And I have to tell you, I want everybody to realize that the only people who do not gripe are insurance companies who are making billions of dollars a year but not paying our providers. And I'm going to tell you something. When you have a heart attack or a stroke in your hometown and your hospital's closed because they cannot pay their bills or their staff or they're running on a skeleton crew, you're going to lose business. Business is not coming to your town because you've got to have a hospital standing there. Your health care suffers. So there's something that has to be done. Everybody's got to come to the table and say, what can we do to save our health care? And your bill, Gerard, and my bill is so high because we're paying for 10 of other people who don't have insurance.
No doubt.
So when you say, well, what can we do to lower the cost of health care? Everybody has got to come to the table, and we've got to come up with something, whether it's looking at expansion, whether it is, having insurance companies, sit down and say, we're actually going to pay your hospital or your provider a decent wage. That's exactly what happened with UMC and Blue Cross. They want to pay the hospital pennies on the dollar and them continue to make billions of dollars a year, and your health care suffers. So, I hate to say this, but government has allowed this to happen, and with a lot of people for a lot of years saying something's got to be done. I'm proud of UMC for stepping up and saying, we're not going to take it anymore, but, it didn't get them very far. I think they've ended up signing a contract, and I don't know what it is for, but we need a lot of hospitals, but they're all suffering. It's hard to stand up and be the rebel when you're broke.
Yeah. So we've got, I was just sharing this with you on the break. Kaiser Family Foundation is probably the most credible, most complete source of everything related to healthcare policy in this country, has been for decades.
That's right.
And I've been subscribing, reading their information, their publications for years, and it's great information. So according to, and they're one of probably the main media sources and research firms that tracks insurance coverage in terms of the numbers and how they receive coverage across the country and by state. So right now, Medicaid is covering 90 million Americans, which is astonishing. When you think about a country of 30 million, almost a third of them are covered by Medicaid, which is free health care coverage, essentially.
To somebody.
To somebody. That's right, to somebody. So we've got this pandemic health emergency, or I should say public health emergency, PHE, at the federal level, which was instituted in 2020 that increased the federal payment to states for Medicaid and also had a continuous enrollment provision that blocked states from disenrolling anybody if they're no longer eligible. Our rolls here in Mississippi have swollen considerably as a result of that.
And not just not eligible, but age out.
Yeah, that's right.
You know,
That's
you
right.
still have it if you aged out.
Yeah, that's exactly right. So now, and that would be under the CHIP and the children's provisions and so forth, right, which is a big chunk of that. So now this thing comes to an end in March 30th is when it comes to an end, meaning that states can return to investigating those on their rolls and disenroll them if they're no longer eligible. Plus, we're no longer going to receive the enhanced 6.2% FMAC, the payments from the federal government. Well, that's going to be an issue for our budget that I'm hoping somebody's looking at with respect to Medicaid funding.
Well, I hope someone is looking at it too. You know, we have very little conversation about Medicaid in the House. On the House side, I don't know about the Senate, but we have very, very little conversation about it.
Yeah, and I think it's Senator Blackwell over on the Senate side, if I'm not mistaken. But then the other thing is that our Medicaid can start disenrolling people who aren't eligible.
Before we're out of session.
Right. So I'm not sure what the plan is there. But this is coming, and I just don't hear anybody talking about it.
There's not been any talk that I'm aware of on my side of the building.
We've gotten accustomed to this federal largesse that was all stemmed from COVID. If you think about just how much of that, I call it helicopter money, just dropped out of helicopters across these United States. And we're no different here in Mississippi. We have taken advantage of that. We're spending it all over the place.
No Republican voted for it in Congress, but the Republicans sure are spending it.
Exactly. So this is coming out as fast. And the other thing that I shared with Senator Horn yesterday, I'll share with you as well, is there's some enhancements, improvements, if you will, to the subsidy model in the Affordable Care Act, such that individuals or families whose household income is less than 150% of the federal poverty level can obtain private coverage for 0% premium. We ought to be promoting the heck out of this.
Which is Medicaid expansion.
Right. It's better than Medicaid expansion. This is private coverage.
Absolutely. And to not look at this is irresponsible on our part, really. You know, I'm a nurse, and I deal with patients who can't afford insulin because the cost of insulin is sky high. Well, guess what? If you don't take care of your diabetes, you're going to be blind. You're going to lose a limb. You're going to have heart disease. The cost of that patient for not taking care of an insulin need is astronomical. And so if you would just look at it as a plan ahead, we need to make sure that this patient that's going to lose their Medicaid has this other program that's available to us at $0.
They don't know anything about it.
And nobody knows anything about it.
Nope, not promoting it. And then I've shared this story before of my visit to the NICU here at UMC and speaking to the physicians there. A number of those babies that are in intensive care, totally preventable with proper prenatal care.
Absolutely. Absolutely, they are. And, you know, we used to do good prenatal care through our health departments. And it's another bill that I have written.
Okay.
Medicaid patients had an OBGYN doctor, and they were all seen through the health department. I'm not suggesting, I mean, we have nurse practitioners now, but they have to go in for prenatal care because our NICU is the most expensive care you can pay for.
Ridiculously expensive.
Right. So we need to look at ways to prevent the cost. And, you know, it's past time. I've been saying it I've been screaming at the top of my lungs.
We had a lady here a couple of times. Her name is Getty Israel.
I know her.
Okay.
Yeah.
Should we be talking to her?
Absolutely. Absolutely,
well,
we should.
I actually told her that I happen to know a few folks in the legislature and in state government. I would encourage you to go back to our leaders and say, let's bring this lady in and just hear what she has to say. It made total sense to me, and she's not just stumping for Medicaid. In fact, what she said was, hey, look, if they won't follow the health recommendations, they get kicked off.
They do.
That's what she said.
They do. So it will it will cost us less in the long run.
Exactly. Well, I hope you'll take up her offer to come speak to you guys about that.
I will.
Appreciate it. Representative Becky Currie has been our guest on Middays. Stay safe.